India is turning to artificial intelligence to help tackle one of its biggest challenges, improving access to medical care. In the second part of our series on India's AI push, we examine how the technology is being used to detect eye diseases and analyze medical scans. Rebecca Bundhun reports for CNA from Mumbai.
This quick scan with a smartphone could help save someone's sight. In seconds, artificial intelligence analyzes an image of the patient's retina and can help identify early signs of conditions such as glaucoma and diabetic retinopathy. All that in a fraction of the time such visits usually take, time that many people simply can't afford.
पहले हम लोग प्राइवेट में ही जाते थे, नॉर्मल मतलब सरकारी में ही जाते थे, मगर वहाँ पे क्या है सर, पूरा दिन निकल जाता था। इसके होते में जाने में मतलब पूरा इतनी मतलब नंबर रहते थे, उसमें इतना टाइम मतलब हमारा जाता था कि हम वर्क पे अपने काम पे नहीं जा सकते थे।
The technology was developed by a Bangalore-based medical device company called Remedio. The AI tool is being used as part of this hospital's community outreach program, screening thousands of residents from nearby slums.
The game changer in terms of AI has been we have been able to task shift the screening process to less trained people who can use the AI to triage people who require the ophthalmologist's opinion. That way we are able to reach a much larger population who could be triaged regularly and referred to the ophthalmologist for a treatment or further evaluation.
It's more efficient, but Dr. Krishnan says the technology is also cost-effective. Remedio says the price of the device is roughly $3,700 and an annual subscription to the software is $1,500 for unlimited scans. This diagnostics clinic in Mumbai has been using AI for more than a year to assist with radiology work, reading scans including MRI images and X-rays. They're processed by 5C Network's AI platform, tech that the company says has been trained on billions of images. It then produces a report, which a radiologist in its network can review and sign off on. The clinic's management says the technology has boosted its productivity, but warns it has to be used cautiously and it cannot replace doctors.
To be honest, I have to really check each and every word and every case before I sign them off, because AI can make it can be really perfect, but at times things can go really haywire.
The founders of 5C say a shortage of doctors in India motivated them to develop the platform.
From the patient's perspective, right, there are two things in radiology. One, radiology is of course very expensive, right, but it's also oftentimes inaccessible.
5C's research shows there is only one radiologist per 100,000 people in the country. Companies developing these AI tools say they could be used to bridge gaps in healthcare access, especially in places where doctors and specialists are harder to reach. The question now is how quickly and how widely such technology can be adopted across India. One of the major barriers is trust.
Initially, there has to be a trust by the provider themselves that, this is a good AI to use, this will give me good results. And that's why what we have done, we have made sure that the technology that we use, it has been validated, it has been published.
In India, AI-powered tools used in healthcare must comply with existing medical device regulations, while patient data is covered by the country's digital data protection rules. AI may never replace doctors, but some believe it could help them reach many more patients, bringing specialist healthcare a little closer to communities that have long struggled to access it. For CNA, I'm Rebecca Bundhun in Mumbai.